They say medicine is about saving lives, but modern emergency medicine was born the moment doctors accepted a darker truth. They could not save everyone. Its origin isn't a miracle, it's a massacre. And the technique that now saves millions every year was forged in the middle of war, where time was blood and hesitation was a death sentence. For most of history, surgery was slow, personal, and hopeful to a fault. A wounded patient meant total devotion. Doctors worked case by case, trying everything, even when chances were slim. That philosophy shattered when industrial warfare arrived. The 19th and 20th centuries turned battlefields into slaughterhouses. Rifles became more accurate, artillery more destructive. Machine guns erased entire formations in minutes. Medical tents filled faster than doctors could think. Hundreds of men arrived screaming. Thousands more were on the way. And suddenly, the question changed from, can we save this person, to who must we let die? This was the birth of triage, a brutal sorting system designed not to save everyone, but to save the most. The word comes from French trier, meaning to sort. Originally used in Napoleonic Wars, it became essential when casualties exploded during World War I. Picture a field hospital near the front lines. Mud instead of floors. Gunfire replacing silence, doctors coated in blood, exhaustion, and impossible decisions. Wounded soldiers poured in non-stop. Some were missing limbs, some gasped through shredded lungs. Some whispered quietly, already fading. There were never enough surgeons, never enough supplies, never enough minutes. So doctors divided patients into categories. Those who would live no matter what. Those who might live if treated immediately. Those who would likely die even with care, and those who were already beyond saving. It felt inhuman. It felt like playing God. But refusing to choose meant more deaths, including the ones who could have been saved. This new logic reshaped surgery itself. Instead of perfecting one operation, surgeons had to work faster than ever before. They learned to amputate in minutes, to stop bleeding in seconds, to stabilize patients long enough to move them away from danger. Precision became speed. Elegance became efficiency. The operating table transformed from a place of craftsmanship into a battlefield of its own. Doctors pioneered rapid wound cleaning to prevent infection. They standardized procedures so any trained medic could perform them. They designed portable surgical kits. They learned to treat shock, blood loss, and trauma in real time. The goal was no longer ideal recovery. The goal was survival. This is where modern emergency medicine truly began. One of the greatest revolutions came from blood before war forced innovation. Transfusions were risky, inconsistent, and poorly understood, but mass casualties demanded a system to replace what bullets drained. Doctors experimented with blood typing. They developed storage methods. They built the first blood banks. What once required slow preparation became a rapid, life-saving routine. Another transformation came from trauma surgery. Shrapnel wounds forced surgeons to understand how bodies fail under extreme force. Explosions taught them how to stabilize crushed organs. Burn victims drove breakthroughs in skin grafting and reconstructive surgery. Every improvement carried a haunting footnote. It existed because someone had already suffered. And then there was the psychological toll. Choosing who lived and who died scarred doctors as deeply as soldiers. Imagine telling a man he won't be treated not because he's unworthy, but because he's too far gone. Imagine walking past someone still breathing because your time is better spent elsewhere. Triage saved lives, but it also reshaped the moral identity of medicine. Doctors were no longer just healers. They became strategists in a war against death itself. By World War II, triage had evolved into a disciplined science. Field medics stabilized wounded soldiers before transport. Mobile surgical hospitals, early versions of modern trauma centers, moved closer to combat zones. Ambulance networks prioritized transport based on survivability. Medicine adopted a new philosophy. Treat the greatest number, not the single patient. That mindset now defines emergency rooms around the world. Car crash victims, heart attack patients, disaster survivors, mass casualty incidents. Every time a doctor prioritizes one patient over another, they are echoing decisions first made in the shadow of war. But this story isn't just about innovation. It's about sacrifice without consent. Many techniques were refined on soldiers who had no choice. Some experiments crossed ethical lines. some progress came at a terrible human cost. Modern emergency medicine carries both a triumph and a burden. It saves countless lives, yet it was shaped by suffering on an unimaginable scale. So the next time you see a trauma team move with calm urgency, when doctors decide who gets treated first, when a life is saved because someone acted fast instead of perfectly, remember this. The system that protects us today was carved out of chaos, written in blood, and built on the reality that in moments of mass death, saving everyone was never an option, only choosing who lives. And that choice changed medicine forever. If you want more cinematic stories about the hidden forces that shaped our world, the wars behind innovation, the breakthroughs born from crises, and the uncomfortable truths history often forgets, subscribe to the channel and step deeper into the past.